One of the most common and honestly most miserable symptoms of menopause is vaginal symptoms, dryness, burning, recurrent infections, pain with sex, and that unsettling feeling of being totally disconnected from your body and your vagina and sometimes from yourself. And here's the part that most women are never told. This isn't just a hormone problem. It's tied to the vaginal microbiome, inflammation, and even the brain body connection, your mood, confidence, libido, and even how safe and comfortable you feel in your own skin, which is why I am so excited about today's conversation. I'm joined by Dr. Betsy Greenleaf, one of the true pioneers in pelvic and vaginal health. She was the first woman ever board certified in urogynecology and has spent over 2 decades helping women navigate menopause, pelvic floor issues, and vaginal health without shame, fear, or sugarcoating. She's the founder of the International Pause Institute, the CEO of the Pelvic Floor Store, and the creator of Femversity, all focused on helping women feel informed, empowered, and confident in their bodies again. And because she's not afraid to do things differently, she's also produced a menopause rock album, which I can't wait to talk about. So welcome to the show, Betsy. I'm super happy to have you here.
Thank you so much, Karen. I'm so excited to talk with you.
I know, I feel like we're already friends.
I know.
You talk my language. We've got the same purpose in life as helping women get through this time period of perimenopause and menopause. And vaginal health is huge, and we cannot talk about it enough.
Yeah, yeah. And it's so interesting because, the vaginal microbiome has been kind of like a personal mission of mine. And I didn't realize it was going to become such a big thing. Now we're talking about the microbiome like crazy.
Yeah,
And really where it started out for me was personally, like from the time I started getting my periods, I was getting yeast infections. And I had
I
no clue
used to
why.
too.
So it became kind of this like mission, like I'm going to solve this problem for myself. And along the way, I kind of solved it for a lot of my patients. And it really came
Yeah.
down to the microbiome. And so I've been doing microbiome testing on patients for, oh God, let's see, we're probably up to 15 to 18 years now. And
When you
so
say testing, are you meaning you're testing the vaginal microbiome or the gut microbiome?
both. Both. Dun, dun,
Both.
dun. Yeah, so how I started out, it was doing the vaginal microbiome. And really what was happening was, I'd find things on patients and you'd go to fix it. And, if you've been a woman who's had these problems, you have an itch, a burn, a discharge, and then all of a sudden you're doing yeast medicine or God knows what other messy type of things, suppositories or creams or whatever, and you're feeling good for a while, and then all of a sudden it's back again. And
Yes.
then and then you do the whole thing again, and then you're good for a while, and then it comes back again. And it's like, why is that? So it really took me years to try to figure it out. Now it's kind of makes all sense. And is that really the microbiome issues are really coming from the gut. And the vagina is just a reservoir for the gut bacteria. Because if we think about how we are anatomically, we have the rectum, the anus, the vagina, the urethra and the bladder very close together, and it doesn't really have to do with hygiene. It's you could be the cleanest person in the world and it can still have problems. It's just very easy for that
Yes.
bacteria to go back and forth. And so why the vagina acts as that reservoir now for like yeast and bacteria, but really it's coming from the gut being off first, and then that bacteria is starting to inhabit the vagina. And I guess the
Yeah.
the real problem is like, why is this like showing up worse in menopause and perimenopause? It's because of the hormonal changes that are happening to the tissue of the vagina. So if we take it actually back and we go to somebody who is is not menopause or perimenopause, they're in their reproductive years, and their
Yeah.
estrogen is normal level, the vaginal tissue will respond to that estrogen and will actively grow. And so that tissue is multiple cells thick. And so it grows and then it sloughs off because the new cells are pushing out the old cells. And that's those sloughed off cells that are, just kind of what happens with our skin. Like we're making new skin cells and they're sloughing off our old skin cells all the time. Well, the bacteria that lives in the vagina, lactobacillus, likes to live off a chemical called glycogen. And glycogen is what's produced in those sloughed off cells. So as long as the vagina is healthily producing new cells and they're sloughing off, the lactobacillus has a food source. And then lo and behold, now menopause and perimenopause comes around and the estrogen levels drop. And so those cells are not actively growing anymore. So now the vagina starts to thin out. And so because they're not actively growing and sloughing off, the lactobacillus essentially starves to death. And so also taking it a step back, why does the lactobacillus keep us healthy? Is lactobacillus, in return for us feeding it, it will make hydrogen peroxide. And the hydrogen peroxide is what makes the vagina more acidic. Because the pH of the vagina should be about 3.5 to 4.5, which is extremely acidic. Water has a pH of 7. So what happens is when the vagina is acidic, these other bacterias and yeasts don't like to live there. But now all of a sudden, the lactobacillus basically dies off because it has no food source because our vaginal tissue has thinned out because of lack of estrogen. And now this is where we start seeing a lot more problems. So now it's where anything that's coming from the gut starts to now inhabit the vagina. And not that it wasn't trying to do that before, but it was kind of being kept in balance by the lactobacillus bacteria. So
What about the period, like the buildup of the uterine tissue? And when you're saying sloughing off, I can't help but think of, is this, the sloughing off is when we get a period, or is just this is the natural sloughing off of the cells?
it's a natural sloughing off of the cells. So it's not like it's all
Okay.
happening all at once. It's like, like as the cells are growing, the new ones are pushing out the old ones, and the old ones basically outgrow their blood supply, and then they just die off. And like it happens with our skin all the time. When you exfoliate your
Yeah.
skin, is you're trying to get all off the dead skin so that you have a nice, glowy skin underneath. So the vagina is doing this too, and it's just like making new cells. But as we get older, those cells are not not happening as quickly. So this is why my biggest argument is when it comes to vaginal health, especially in menopause and perimenopause, it's like, well, I see people buying different things like probiotics. You can take all the probiotics in the world, but if you don't have anything that's feeding those cells, the probiotics aren't going to stay where they need to be in the vagina. Like you can use probiotics suppositories or creams or take them orally, but it's not going to help because we have to do something to regenerate the vagina. So
Which is the estrogen.
or there's a bunch of different regenerative therapies. So, but
Okay.
traditionally it has always been estrogen, but there is a whole, and actually it's fun because I'm going to be lecturing about this on the BHRT Training Academy, their cruise. They have a
Oh,
cruise
nice. Yes, I
conference.
saw that.
I'm very excited. So I'm going to be lecturing about it there, all the regenerative things, but I can, start mentioning some of them here. Um, so
Yeah.
basic, yeah,
Oh, I just wanted to say,
yeah.
because as you're talking, and I'm thinking to myself, because I just went on this rant on my last podcast that I just recorded about what I was seeing on social media
Mhm.
about hormones and hormone replacement therapy and menopause and symptoms of menopause. And there was all these women that were coming on and commenting things like, oh, this one woman that I mentioned, which I just thought was the most ridiculous one, was I just eat pastured egg yolks and I drink rose water and I have no menopause symptoms. And I'm like, oh my God, woman, like, great.
Good for
That's
you.
awesome that
Yeah, not
it's working
everybody
for you.
not everybody
Right.
has
But
symptoms, but I don't think that's doing it.
no. And I just, when people will say menopause is natural,
Yeah.
like these things are supposed to, like, why are we messing with this? And then I hear what you just said, and it's like, yeah, but look at what our bodies start to do.
Yeah.
And look at that, that's how we lose vaginal integrity, because we start by losing estrogen.
Yeah, and
And
it's
so
not.
then I think, like, why wouldn't we then use estrogen and other means to rebalance that. Like, I don't want to live with that just because it's a normal part of aging. No, thank you.
And especially in the elderly, we see such a problem with recurrent urinary tract infections, and they can become life-threatening if they get into the bloodstream and you get sepsis or you get a kidney infection. And the main cause or the initial cause of a recurrent urinary tract infection, especially in someone who's postmenopausal, is what's called vaginal dysbiosis, meaning that shift in the bacteria that's in the vagina because we've lost that ability to feed the healthy bacteria and let the healthy bacteria stay there. So, and it is a combination between gut health and hormone balance. So, yeah.
Okay, let's dive in. I just had somebody, and this will have aired relatively soon, relatively before this one airs, all about gut microbiome.
Oh, that's my favorite one too.
Kiran Krishnan came on, and he
Oh, yeah.
is like the microbiologist. Like, he is so smart with the gut microbiome. It was
Yeah.
such a brilliant episode. And so this is going to come perfectly after this, because now it's like, okay, we understand what's going on with the gut microbiome. How does this influence the vaginal microbiome?
Well, and
Because
here I
most
can
people don't
actually,
put that together.
I'll actually blow your mind with this. There is a gut vagina brain connection. So everyone talks about the gut mind, the gut brain connection, but there actually is a brain, it depends on which order you want to say it, and a brain gut vagina connection too.
Yeah,
Because
I had heard there was a uterine brain
yeah,
connection.
yeah, all of
So
it.
when you get a
Yeah.
hysterectomy, that can influence something in the brain.
Yeah. So, and
Oh,
more so,
okay.
so let's just even talk about the gut. Let me talk about the gut for a minute and then we'll get into the vagina.
Yes.
But
Yes.
then I'm sure he talked about it, but
It's okay.
90% of your happy hormone is made in your gut. So your serotonin is made in your gut. 80% of your immune system made in your gut. So if your gut is off, you're higher risk of depression and anxiety, and you're also at higher risk of recurrent infections. So starting in the gut, there's potentially some issues. And interesting enough, another whole microbiome crazy thing is the microbiome of menopausal women is more like that of a man than you are like when you're in your reproductive years. So our gut microbiome actually even changes in menopause. So, all right. So now we're getting shifts in the microbiome, and I'm sure like he went into depth, but I'll kind of cover really quickly. What are the
That's
things that
okay.
throw off the gut? Stress, inflammatory foods, antibiotics, environmental toxins. Not a lot of things you can do about environmental toxins, but lifestyle and health and your diet, there are things that we can do. So I always tell people like you should be eating things that fall into four categories, and they are your food should have at one point walked, swam, flew, or grew. If it falls into those four categories, then it's okay to eat because there's no free range Twinkies, Doritos aren't growing on trees. Like those are the things those processed foods and high sugar foods we should probably stay away from. Um, so if the gut is off, we now have an overgrowth of not necessarily bad bacteria, but not ideal bacteria because you want everything in balance. And so if the gut is off, now once again, we said the anus is very close to the vagina, and no matter how well you clean, that bacteria or yeast or whatever microorganisms, even parasites can now get into the vagina. And if the vagina is not ideally balanced for hormones, then those bacteria are going to take over and kind of, we lose the lactobacillus. But here's where the vagina now is connected to the brain is that the body only likes to reproduce when things are in balance. And so if the microbiome of the vagina is off, it actually sends a message to the brain through, they believe, the vagus nerve that dampens all processes of reproduction. Now, the brain doesn't know the difference between you're trying to have a baby versus you're trying to have fun. Like it's all the same thing, to the brain. So
Yeah.
it will not only decrease fertility, but it will decrease libido. So in our menopausal women, what's happening? Their vaginal microbiome is getting thrown off. And so that can be a source of a decreased libido not just the fact that their hormones are low. So what we see a lot of times are women come
Oh,
in and they are like, oh, I want to go on hormones because my friend went on hormones and because of low libido and I want to be like her. And then that person gets put on hormones and they're like, what the hell? Sorry. They're
go
like,
ahead.
wait,
Go ahead. It's okay.
why? Yeah, why is it not working on me? Well, we need to look at your microbiome because if your microbiome isn't balanced in the vagina, and also there's research that shows that gut microbiome can also affect libido. So that if that's not balanced, that's going to dampen the whole sex drive too.
So
So,
it's not that it's lowering the hormones or
mm-mm.
strictly
it
from lowered hormones. There's something that's signaling to the brain saying, oh, the microbiome here is off. Not a good time to get pregnant. So we don't
yes,
want to give you a sex drive because no point in trying to go have sex because the only purpose of sex in the brain's
yes.
eyes is to procreate.
Yes.
It
And
always,
so
it all
therefore
comes back to that.
yeah,
Everything.
the brain goes, "Hey, you know what? It's not ideal." Like the brain is sensing inflammation, whether that's vaginal inflammation or gut inflammation from the microbiome in the different places. And so because it's sensing that inflammation, it goes, "All right, this is not the perfect time to be having a baby." And so therefore like we're just gonna forget this. So and in fact, actually, I have a funny story about a friend of mine who was a nurse and not menopausal, but she was in her reproductive years and was having unprotected sex with her boyfriend for like 6 years and never got pregnant. And just she just thought she couldn't get pregnant. And she was seeing the kind of work that I was doing in my office, and she's like, "Can you test my microbiome?" And I did, and her vaginal microbiome was completely haywire. So we spent some time getting that in balance. And lo and behold, she ends up getting pregnant because she
Oh
thought
my
she couldn't get
God, of
pregnant. And
course.
then, surprise. And so she jokes around that I now owe her, like, I have to put her kid through college because I'm the reason she got pregnant. But it was really the microbiome was, that's when I really started putting it together. And I'm like, oh. And then when I unmasked the gut one too, I was like, oh my
It's
goodness. And then
amazing.
finally the research has been catching up with that. So yeah, because now we see it
Yeah.
proven in the research.
Is there anything that's in the research yet about the effects of Mirena IUD birth controls and then just birth control, like oral birth control in
Yeah.
general? Is
Yeah.
that because I've heard that anybody that's on birth control will have a leaky gut? Like it
Oh yeah.
definitely is
The
not
oral
good
birth
for our gut health.
the oral birth control is horrible for gut health, and it also is horrible for it affects us
Vaginal.
absorbing certain vitamins also. So
Yeah.
you don't, yeah, combination, it throws off the gut and it affects our vitamin absorption.
And then
So
in turn will
yeah,
affect the vaginal.
yeah. Yeah. Oh, yeah. And it definitely affects the oral birth control definitely affects vaginal microbiome because the people on oral birth control have a vaginal microbiome very similar to a menopausal woman because they get thinning of the vaginal tissue. Same thing happens also in pregnancy because of the levels of the hormones, but pregnancy is so short-lived that hopefully, it rebalances back out. But yeah, but you can get that thinning of the vaginal tissue in it's not just menopause, pregnancy, birth control are the main conditions that will happen with.
What about IUD? I swear I've heard Dr. Felice Gersh say something about IUD causing leaky vagina, she said.
You know what? I think they're starting to show some more research on that. It's it's one of those things because when I given the choice on birth control, I rather someone have an IUD than take it orally. So it's one of
Same.
those things. It's like, because the
Yeah.
unfortunately the risk of pregnancy on your life and your health is a lot worse than the risks of the birth controls and the IUDs. But if I had to pick something, especially in perimenopausal women, because that's when they really need it because their periods are all over the place. So the IUD, the progesterone, especially containing IUDs are better. Um, yeah, as I say, they're better because they also will potentially decrease the risk of what's called endometrial hyperplasia or endometrial cancer because the
Yeah.
progesterone helps stabilize that lining of the uterus so it doesn't overgrow. And that's where, in that perimenopausal period, we have these conditions where we are at like extreme. It's either our progesterone's too low or estrogen's too high, or they're high and low in comparison to each other. Like they might look laboratorily normal, but in comparison to each other, they look high. And we don't want to be walking around with high estrogen because that puts a higher risk of having endometrial problems, lining of the uterus problems.
Yeah, and if
So,
bioidentical progesterone, if that's the first line of treatment and that doesn't take care of the heavy bleeding,
yeah,
then it's like, oh, hysterectomy, ablation, or a Mirena IUD. And as
yeah,
much as I'm not one for birth control, I think it should be available 100%. Women need the
yeah,
choice. I'm all for it. But when we look at, okay, what's the best option here? That is like, I would much prefer a woman to be on a Mirena than an oral
yeah,
birth control, and especially for something like that. And then also, we're seeing more and more women have progesterone sensitivity when it comes to progesterone HRT.
yeah,
And that the IUD that has synthetic progestins doesn't have the same effect on the neurotransmitters in the brain that oral progesterone, bioidentical progesterone
yeah,
does. So
yes,
sometimes it's just a nice option if they can't tolerate progesterone, which we've had a couple women, not very many, but a
yeah,
couple that it was so bad their progesterone sensitivity that no form of progesterone worked. That was the only thing that they could use to counterbalance the estrogen HRT.
yeah. No, that's great, great
Yeah.
point. Yeah,
Yeah. Oh, yeah. Oh, that this is fascinating. And also because if a woman then chooses to have a hysterectomy, I'm just thinking like now that there's a brain connection with that too. And so it's just like weighing your options as to, okay, well, what's the lesser evil of these things, you know? Do we have the
exactly.
hysterectomy or do we maybe do something else that, maybe isn't the best, but is a better option than ripping it all out?
Oh yeah, yeah. And I think even I no longer do surgery, but even when I was coming to the end of my surgical career, um, I think prior to that, it was always the answer was take out the uterus. And it was like, why
Yeah.
would you take out a uterus if it's not having problems? Even with prolapse, which what I used to do surgeries on was putting the vaginas back up where they're supposed to be. We used to say we'd do facelifts down there because things start drooping and dropping as you get older and affects the ligaments. We'd be like, it's not the weight of a uterus is not what's causing the prolapse because I'm postmenopausal uterus is like the size of a walnut. So it's not like this giant organ that's like sitting there pushing things out. So yeah, there's no reason to take things out if it's not causing any problems. But if you're a person that has those issues, like don't be scared of having them taken out because there's lots of things that can be done when it comes to balancing the microbiome in the vagina and helping with libido and balancing gut microbiome and yeah.
I'm going to push pause here because my dog's barking at something. So I'm
Sure.
going to tell her to be quiet. Hold
No
on.
problem.
Edit this. She probably saw a cat. Okay, see, this is the other beautiful thing about Descript is you can just clip everything out that you don't want.
Nice.
Manual, like you just go click. Okay, that part I want out. Okay. Okay. Uh, okay, I got it. Why is it that we get these recurrent yeast infections? And when you were talking earlier, I remember that when I was in my fertile years, I also had chronic yeast infections. I totally forgot, but for years, and same with my mom. And what finally fixed it was I did a soil-based probiotic that it
Yep.
was an oral probiotic, and I had never had a problem since.
Out of curiosity, just
Yeah.
out of curiosity, when you were getting these recurrent urinary tract infections, did you ever have problems with sweet cravings?
No idea. It was so long ago.
And the reason I bring that up is because the other thing they're finding out with the microbiome is that bacteria and yeast can actually hijack our nervous system and affect our behavior. And the reason why I bring that up specifically is yeast likes to live off of sugars. So some people that
Yeah.
have a lot of gut yeast tend to have a lot of sugar cravings because it's actually the yeast that's driving that behaviors to feed itself. And so therefore, if we have a lot of gut yeast, then we tend to get some vaginal yeast with that too. So, I mean, the other thing is the vagina yeast likes a warm, wet, dark environment. That's the, that's the vagina. So, especially in the summer times when you got, maybe in a bathing suit or you're in like sweaty clothes and not changing them often. The other thing that this is the only thing that nature has done that has not made any sense to me, and I'm still trying to figure this one out. We talk about the vagina being very acidic, and it's acidic
Yeah.
when it's healthy. Um, Semen is very basic. So on a pH scale of acidity, vagina is a 3.5 to 4.5. Semen is about a 7 to 8. So in women that are having sex with men that then ejaculate inside them, it will throw off their pH of their vagina. And now they can have, some women are more susceptible to getting recurrent infections because of that. So,
Because it's for some, and it's gonna change the pH because their pH is so high. Do you
yeah, well, it's,
think?
it's just
Like
that
something
it'll change the pH of the vagina because of the semen being 7 to 8 the pH. So it will
is
temporarily change the pH of the vagina, and so that can
to
in
being more
some
acidic or less acidic?
less acidic.
Less acidic, because the higher it is, the less acidic, right? Yeah,
Yeah,
I had
yeah,
that
yeah, on the pH
opposite.
scale.
Okay.
Yeah, yeah. It goes from 1 to 10. One is like acid, like it's gonna eat through the table, and 10
Not
is
what we
like,
want.
10 is actually also very irritating. Set water is 7, is right in the middle of that scale, or
Okay.
actually, 1 to 14. Sorry, but yeah,
And what about
sorry.
then? So there's the yeast infections, but then I think too, we have an increased rate of vaginal bacterial vaginosis, sorry,
Yep.
bacterial vaginosis, also in perimenopause.
Yes. Mm-hmm.
Okay,
Yes.
can you explain what the difference is between the two and why does that happen? That's
Yeah. So
not
it
fun. I
it,
had
it
that once in my fertile years, and that's not, it was like, oh, that does not
yeah.
smell very good.
And unfortunately, like a lot of people, when they think of like a bacterial vaginosis, they think of a fishy odor. That fish
Hmm.
odor actually comes from the type of bacteria that now kind of is taking over. And when those bacteria open up, they release what's called amines, and amines have a very fish smell to it, unfortunately. So it's the same thing as some of these bacteria and yeast are just in the environment. You just kind of get them. It's not like, I
It's
know.
not an STD.
No, I mean, though I say no officially, though there are some bacteria and yeast that can be passed between partners,
Yeah,
especially if it's
okay.
becoming recurrent. But I like to actually look more so at the gut being the source, and then looking at, is the vagina pH balanced? Is the vagina healthy and growing and providing food for the lactobacillus that's there? Do we, the body does very well with diversity, so it means the more types of bacteria that you have on it in your body, the healthier you are. So it's just a lot of times why we're getting these infections is because the microbiome diversity is getting shifted in the gut. And then we're losing the protective bacteria like the lactobacillus in the vagina. But to keep the vaginal bacteria, it's really keeping the proper pH and then providing it with food from actively sloughing off tissue, which then we say, well, how do you do that in menopause? And that's either the traditional options, which are using topical hormones, and any of the hormones will actually help cause the vaginal tissue to regrow. So we tend to often go for
Hmm.
estrogen, but
Yeah.
progesterone will also do that. Testosterone will do that. DHEA will do that. So all of those are options. Um, There is an oral medication. I don't happen to use it that much. Never, for whatever reason, was never a giant fan of it, and I don't have a really great reason. But there's one called Asfina, or Aspemifene, and it's a estrogen receptor modulator. So it's not a hormone, but it tricks the brain,
I've heard about
it
this.
tricks the receptors in the vagina to think that there's a hormone there, and it will cause the
Just
growth.
specific to the vagina?
Yeah, yeah.
Yeah, okay.
So, so that one's that's on the market. But then there's also a lot of the regenerative therapies, and I think that's what's exciting is that I wish I came up with this because I look back and I'm like, man, that's so smart. But like, for example, lasers in the United States,
Yeah.
vaginal lasers have been on the market since about 2016. They've been out in Europe way before that. I don't know about Canada, but they basically lasers have been around for aesthetic purposes since the mid 1980s for skin regeneration. And it's basically the ultimate biohack because basically all these things do is they cause microscopic injuries to the tissue, which doesn't sound fun, but the light energy from the laser will come in and make a little channel in the skin, and the body senses that as an injury and will flood the area with growth factors. So it's another way to trick the tissue to regrow. That's people have been lasering their faces, like I said, since the
Yeah.
1980s. That all of a sudden somebody was like, well, wait a minute, if we can do it to a face, why can't we do it to a
Let's go to the other
vagina?
side, to the other end. Yeah.
I was like, man, why didn't I come up with that? So when the first laser came on the market, that's when the floodgates opened because people were like, wait a minute, if lasers do this, what are all the other regenerative things we're doing to people's faces? Could we apply that to the vagina? And that's where we saw everything from lasers to things called radio frequencies using sound waves that generate heat. And when we know that if you heat tissue to a certain temperature, it will cause collagen regeneration and tissue regeneration. Microneedling, where we just make microscopic little kind of pinpricks into the tissue to trigger the tissue to regrow. Um, and then what happened was a lot of those treatments that came out on the market, and even they were injecting platelet-rich plasma, which was extracting your own blood
I was
and
going to
kind of
ask about that.
yeah,
Yeah.
taking out your growth hormones from your own blood and then injecting it back into the vaginal tissue.
That does
Those
not sound fun.
no, all those were kind of happening before the pandemic, and you had to go to a practitioner. So then the pandemic happened, and people weren't going to their practitioners, at least not in the area that I lived in. And so then we saw literally more home-based products that came on the market. There is a product that uses red light therapy because we know red light, light at different frequencies triggers the mitochondria, which are the anti-aging powerhouse of your cells. So, and that actually reverses the aging process, but also can stimulate tissue regrowth. So, you see, like people with the red light masks on their faces,
Yes.
like they work. They make they make red light vaginal wands too. So that you do it at home and you can rejuvenate the vagina that way.
I don't know if
There,
it could access the ovaries, but aren't the ovaries the most rich with mitochondria?
that would be very, yeah, no, the red light won't get
It
that far.
won't.
Yeah,
Okay.
but that's
Darn.
interesting. Yeah.
Rejuvenate our
But
ovaries.
now you're on my wait, what can we do with ovaries now to regenerate? That would be fun. But yeah, and
Yeah.
there's even a gel called carboxytherapy, which uses a carbon dioxide. And when you apply carbon dioxide in a gel form to tissue, it pulls in oxygen, and when we oxygenate the tissue causes the tissue to regenerate. So there's so many different products, and now the most recent ones are exosomes. So we're starting to see some vaginal products coming out containing exosomes. Exosomes are basically chemical messengers that tell the tissue to do whatever that exosome is designed to do. If it's like, hey, regrow, then the exosome can cause regrowing and healing. So, and they're
I was
naturally
given some
yeah, they're
exosome,
naturally
like vaginal exosomes, but
yeah,
they've scented it with like a
yeah.
cookie smell. And I'm
Oh
like,
yeah, no,
I
no.
just want my cookie to smell like it's natural
Yeah,
cookie, not
yes,
smell like, thank
exactly,
you.
exactly. Yeah. No, I hear you.
Yeah,
I
but
don't
I
understand.
didn't know like how it worked per
Yeah,
se. So the exosomes. And so would you get that injected too?
So some of them can just be put topically. Like I've seen some
Yeah, okay.
of them are making them in a gel that you can just kind of put in the vagina topically. I will tell you that none of this happens overnight. So like if you're somebody that's been in menopause, let's say you're in your mid 70s, you can regenerate the tissue. It's just going to take longer and more treatments to get it back to the way it was. If you're somebody in your 40s, they're actually starting to talk about doing these things preventatively and starting it earlier so
Thank
that
you.
you
Yeah.
don't get, and the more you
Yeah.
combine things, the better. So let's say example, like people come in and they want their vaginas lasered and it's like they think like, oh, it's going to work overnight. Well, it takes about 3 months to rejuvenate a vagina. And that's whether you're using estrogen cream or you're doing a laser. So it's going to
Yeah.
take a good 3 months to get that tissue back actively growing and kind of get that balance back of the microbiome.
So if
So
somebody comes to you and so they're having vaginal issues because of perimenopause,
yeah,
would you start then with the testing of the vaginal microbiome as well as the gut microbiome?
yeah, I always do
Ideally?
that. Yeah, yeah.
Okay.
And in
So
fact,
and then do you
yeah,
see them match up? Like in the
because
sense of like, oh, your gut's terrible and so
yeah.
is your vagina.
Yeah. It's actually not that it's fun for the patient, but it's fun for me when I have
Yep.
somebody that's been coming in with a lot of recurrent urinary tract infections. And E. coli is usually the most common bacteria that we see in bladder infections. And it's fun for me when I find that the E. coli is in the vagina and it's also overgrown in the gut. So I'm like, all right, look, we just got to fix all these things along the way and we'll get it all balanced.
And then then target both at the same time?
Yeah, I typically do. But also it takes probably about 3 to 4 months to rebalance a gut too. It's not just like I see some people are like, "Well, I'll just start eating healthier." That's great. Getting more fermented foods in the diet, getting a really, if you don't like fermented foods, I tell people you need to at least have one serving of fermented foods every day, whether that's kombucha, which are fermented teas, and a lot of these you can find in the supermarket now. Um, if you don't have problems with dairy, the yogurts or kefir. If you have to eat bread, not that I really want a lot of people eating bread, but not everybody has problems with gluten. But given the choice, a sprouted wheat is better or sourdough. Sourdough is actually not that you're going to get the probiotics from it, but those have less of the sugars in them than a regular wheat bread or
Yeah.
white bread. Yeah. Yeah.
Yes.
And then, well, the other thing is you could be taking all the fermented foods in the world and all the, probiotics. If you're not ingesting fiber in your diet, then forget it because the bacteria likes to live in the gut bacteria likes to live off of fiber. The vaginal bacteria likes to live off the old cells. The gut bacteria likes to live off of
Okay.
fiber. So that's why we need more fiber in the diet. Fruit, vegetables mainly would be the ideal,
Will
some grains.
growing the good microbiome though, will it crowd out the bad? Or
Yeah.
should we be like, if so, let's say you find E. coli, are we killing this off first?
Yeah, a lot of times we are. And so, because it's sometimes just doing the diet doesn't do it. So sometimes we need to
Mhm.
kind of, take care of it. I really don't like to use antibiotics. If I try to put off using antibiotics as long as I possibly can. Often I will use different herbs to do it. So
Yeah.
depending on what's there, anything from oregano to like berberine are certain herbs that are often used to kind of get rid of that bacteria. So the idea is you want to get rid of things first, and then you want to like heal the gut, and
Rebuild.
then you want to put back some new stuff in there to get it to work. But even
Yes.
then, it's interesting from a microbiome standpoint. They say Tibetan monks have the best microbiome in the world. And the reason
Why?
why is they meditate like 6 hours a day.
I was gonna say because they're not stressed.
So
All
that's
they
the
do
other
is,
problem is stress can affect your
oh,
microbiome. Now, nobody has time to meditate like 6 hours a day. But the point is like if you're stressed and you're doing all these healthy things, it's not going to work because I always tell patients like pure wellness and health is like a three-legged stool, a body, mind, spirit. And if all three legs are not equal, it's just gonna fall over. So you could be like
Thank you. Yeah.
exercising, eating perfectly, but if you're stressed or don't have like a sense of spirituality or sense of community, like doing things with friends, like that's
Yeah.
going to affect the body too. So it has to be like this very well-rounded aspect of everything. So,
Yeah, I would just, the lady I was just interviewing, she's a friend of mine, Dr. Shivani Gupta, and that's what we were talking about was just that spirituality piece being the missing link with so many women that have issues going from perimenopause into menopause. I'm taking the HRT, I'm eating protein, I'm lifting weights, and I still don't feel good, and I'm still really tired, and I don't have a sex drive, and I've tried the testosterone, and it's like, what about your stress? What about your spirituality? Like, are you making sure these things are supported? And people don't put enough emphasis on these things.
yeah. Oh yeah. That's,
Like,
I think
it's crazy.
it's the simple things that actually have the biggest impact. So
Yeah.
it's like focusing on sleep, like focusing on drinking enough fluids, like not being stressed. And, I've started to use my calendar as a personal development tool. Like I actually will block out my shower every day. And I'm like, because what would happen is I
Right.
try to get one more thing done. And not that I wasn't showering, but like I wasn't taking time for myself. Sometimes
Yeah.
I wouldn't, I will schedule my lunch. Like otherwise I wasn't eating lunch. I'm like, nope, lunch is on the
Just
schedule.
talking about
Nothing
this.
else
Yeah.
is taking this
Yeah.
place. And sometimes you
If
have to
not, then we
schedule,
just work, 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 work.
and I joke, but I tell people like my patients with low libido, sometimes it's like you have to schedule sex. Like whether
Oh,
it happens or
100%.
not, you got to at least put someplace on your calendar where you're going to have, time with your significant other or time by yourself or whatever that looks like. So
So
that's,
I will put it on the back burner. Let me tell you,
yeah,
I am the worst for that. And if I am even remotely stressed, which I feel like I am all the time,
yeah.
I have a very hard time getting in the mood. And
Oh, yeah.
so if it wasn't scheduled, I probably, like my poor husband,
Yeah. Oh, yeah.
right? Because I'd be like, no, no, I got too much today. I got too much to do. But we have like a standing date every single week. And all my friends know about it. They laugh at
It's
me
sex
because they're
night.
like, hey, Karen, could we, no, it's in the morning because
Oh,
I'm not a nighttime sex person.
yeah.
So it's like, I just said that to my girlfriend the other day because she said to me, oh, well, let's meet, let's have a call on blah, blah, on Friday. And I'm like, she's like, oh, wait. That's a sex morning, isn't it? I'm like, yes, we
I
can't.
love that.
Nothing. I can't book anything on Friday mornings. And she's like, right. And I'm like, really? I'm like, the people that think that women or I guess men that think that their female partner wants to have sex at the end of day at 9 p.m. in bed. Are you crazy?
No,
Like, I
I
can't believe
agree.
any man gets laid if they're trying to have sex at that hour.
Yeah. And that actually brings up one of my other favorite topics that I love to talk about also is this that sex and stress can't coexist. And actually, if you
Uh-huh.
look at the biochemical pathways for which our sex hormones are made, they're only made in a relaxed state. So that if there's any stress, you will like, so actually, cholesterol is the parent hormone and we vilify cholesterol, unfortunately, but we need cholesterol in a relaxed state to be come down and made into our sex hormones like testosterone, estrogen, progesterone. But if there's any stress, that will get made into cortisol. It goes down a different pathway. And so stress to the body looks like different ways. It could be emotional stress. It could be inflammatory stress from the microbiome, connecting
Just be
everything.
life. Could
Could
just be
be,
being a woman in
yeah.
2026.
And then this is the other problem is that you got the people who are taking BHRT, so they're taking their hormone therapy and they're like, I still don't have a sex drive. Well, we need to go look at your stress because you could
Yeah.
be
Oh my
back
God,
converting those
yes.
hormones into cortisol. So you could be taking all the hormones in the world, but if you're stressed, your body's going to be like, no, I need that for cortisol. I need it for cortisol. And cortisol was only supposed to be, and cortisol is not terrible. We need a little bit of it. It's supposed to be a very
Of
temporary
course, yeah.
hormone. It was
Yeah.
like to get us away from, like, if a lion jumped out of the bushes. It was supposed to give us like sudden burst of energy, sudden, like, strength to be able to fight or flee or, fright, stay so still that the lion didn't see us. But it was only supposed to be a temporary thing. And then we're supposed to go back into relaxation where reproduction takes place, gut healing takes place, healing in general takes place, digestion. So, yeah.
And yet we just have such a hard time, don't you think, like implementing self-care.
Oh,
I
yeah.
mean, we've talked about this for years, and we as practitioners, we're constantly telling our clients and patients that, hey, you got to put some time in for yourself. And women are just like, they just, yeah, like, yeah, I've heard that.
And I think,
And they think they're doing fine.
I
It's
see
like,
too
no,
many
you're not.
women to put it off, especially if they have kids. They like put it off, and kids and careers are the big ones that really kill everything. So
Yeah.
they put it off, put it off, put it off, and then the kids are growing, they're like, "Oh, now I can focus on myself." Well, now you have all those years of inflammation and stress built up. I mean, it's good, start it now because it's better than not starting it at all,
But still,
but
I was listening to the Diary of a CEO yesterday, and it was Stephen Bartlett interviewing another man. And they started getting into the conversation of how important it is for people in relationships to still be doing the things that they love to do. And Stephen Bartlett's like, yeah, like I think that we really need to hold on to that as, as like, I need my time with my guy friends. I need to go talk about sports or go golfing or, one of these things. And he's like, if my female partner is telling me that I can't be doing that, and he's like, and I've got friends like that. I'm sure you got friends like that, that there's these guys that they're not allowed to do any of that. And it's really important that we hold on to this. And I'm thinking to myself, okay, yeah, I agree, gentlemen. Yes, hold on to these things. But here's the difference between man and woman. My husband has no problem saying to me, I'm going golfing with my guy friends for 8 freaking hours. Like, golf is not a 1 hour little time slot. This is a full day you're not going to see them for. 8 hours, see you later, no freaking problem. Women, that would be the day that you would find a mother of smaller children saying to their male counterpart, you know what, I'm just going to go golf, or I'm going to go have a pedicure for 8 hours with my girlfriends. See you. Like, we don't do it. Like, we feel horribly guilty.
yeah.
We're just like, oh, God forbid we don't, sit here and take care of everybody else's needs. It's awful. And so we have a very hard time. I think we value our worth on how much we do, and we got to get over that. We do. We
Yeah.
need to find balance.
Yeah, I think like as I get older, I realize I have to stop being a martyr because all
Totally.
it's doing
Oh,
is affecting my health in the long run. So yeah. But
it's
it's
true.
hard. It's always like go, go, go. And I'm like, all right, I'll do that thing for me when everything's done. Well,
Yeah.
then nothing's ever done. There's always something else. So just take the time. Just because you want to make sure you're
Because how
around to do
much
all
do
those other things.
and like how much do you see this in your practice
Oh,
where
all the time.
stress is like the thing that needs to be handled before because you've done everything else.
Yeah, that's the hardest thing I think as a physician or any health practitioner is like there's only so much that I can do or so much I can tell you to do, but you're the one that has to go home and like get your 7 to 8 hours of sleep, 7 to 9 ideally. You're the one who has to do the exercise and you're the one who has to drink the fluids. You're the one who has to like do something like relaxing, whether it's a hobby or even just, meditating or whatever it is. Like, I can't do those things for you. And those are all the things that you need to get everything else to work. So,
Giovanni had some good advice. She said, don't look at it like a task, another task. She
mhm,
said,
that's good.
call them routines and rhythms. She
Ooh, I
said,
like that.
so my routine is I make sure that I lift weights 3 times a week. I get into this rhythm throughout the day where I take breaks and I have a cup of tea because tea is my sacred space. It's like you can't drink it quickly. It's hot. So you got to slow down. And she said, that's my routine. It's my rhythm. And she said, this is what to call it that totally changes the energy around it.
I love
Then,
that.
oh, I gotta go work out. Oh, I gotta eat protein because Karen said that I have to because I'm in menopause.
Yeah, yeah. Oh my
Okay,
God.
so a woman comes to you. We're testing the vaginal microbiome. We're
Mm,
testing the gut. We're going to then kill off any infections and then rebuild this gut and then feed the gut.
yeah,
We're replacing with hormones
yeah,
if the person's a good candidate for them. And I love that you said all of the hormones can really help with the vaginal tissue. That's really
yeah,
cool.
yeah.
Uh, Estriol, I heard, is I heard a doctor actually, and I don't know if you know anything about this, and I haven't been able to find anything to support it, but they're two very well-known doctors, a husband and wife, and they do HRT, and they said that estriol is a different pH, and so it's better for the vaginal tissue for yeast infections than estradiol. Have you heard that
I'm
before?
gonna have to look into that. I don't know. I know I've used estriol vaginally, but I haven't looked at the pH. Um, that's something I will definitely have to check into. And then I also kind of wonder
I don't know if you can hear me, but you're frozen on my
about
screen.
how it's mixed, like what it's made with and how that affects things. So,
There we go. You're back.
oh, did you
Can
not
you
get
hear
any
me?
of that? Yeah, you froze too. So,
Oh, okay. Yeah. I see you froze. I did it in that, but yeah, I was like, ah, and in all, so you ended at, I've used estriol.
yeah, I've used estriol before vaginally. I have never really looked into anything about the pH. I
Yeah.
wonder about the actual hormone versus what it's mixed with, because a lot of times it's what they're made with. So I don't know. I'd have to look into that a little bit more.
Yeah.
So,
Yeah. I have,
yeah.
like I said, I haven't been able to find anything to back it. And I also remember hearing a different physician say that estriol that were like super rich in the receptors, which would be the better receptors in the vaginal tissue. So that estriol is can be better for the moisture of the vaginal tissue.
Yeah, out of the different types of estrogens, reason why they use estradiol very often is because it's more bioactively available. So, like, it
Mm,
just is easier. So, where estriol is like the least bioactive out of all of
yeah.
them. So that's the only reason why they often choose estradiol, just because they can use like less of it to get a bigger result. But I do like
Wow.
estriol because it has some breast protective activity
Mhm.
to it. So yeah.
Yeah. Yeah. Yeah. Definitely. Well, my vaginal moisturizer, it's got estriol and DHEA. I chose not to do the estradiol. And actually, I just had a customer ask me, why didn't you put estradiol in there? And I was like, well, it's not,
They're
estriol is
good.
not proliferative and estradiol is. And so it's just, it can be, I think more people would purchase it because of that.
Well, the also nice thing is the DHEA is going to convert into testosterone
Into
and estrogen in the tissue
estradiol.
anyway. So
That's what I told her. I'm like, it's going to
yeah,
go into estradiol anyways down
yeah,
the road.
yeah.
It's just
So you're basically killing one, two birds with one stone there. So yeah.
yeah, because some people will advertise like, oh, it's got no estrogen in it. This is just a DHEA vaginal moisturizer. I'm like,
Yeah.
however, it's going to convert to estradiol. So,
Exactly.
and so,
Exactly.
okay, so we've got all of that. And then I wanted just to ask, like, what are your favorite tools besides that? Like, so you do like the red light wands, which you can
Um,
now purchase on your own,
yeah.
or you have to
Yeah.
go to, oh,
It depends. It depends on which level you get.
okay.
So, yeah, it depends on what level you get. There are non-medical grade red lights, and then there's medical grade red lights. So obviously the medical grade ones have more lights in it. So it
Those
depends
ones
on
you have to go into office for.
yeah, yeah. So
How often would you do you treat somebody with that if
so with
they've
the
got
red
vaginal
light, you
problems?
actually start having them using it about It depends on how well they tolerate it. If they want to do it every day for 2 weeks, but a lot of times I'll do it every other day for 2 weeks. And then you just kind of keep doing, then the idea is you keep doing it like at least once a week to kind of maintain the tissue. But it depends. I like it actually works really great when you combine it with other things. So if you combine it with a cream, it works great. If you combine it with a laser, like I find that anytime you combine therapies, they work just a lot better.
Yeah.
So,
And so that'll thicken the tissue in the
yeah, and
vagina.
keep it healthy.
Keep it healthy. Keep
Yeah.
those
And you know
cells
what? That's
healthy.
actually I want to bring up something that happens a lot because I have a website that we sell pelvic health products and we actually sell those red lights. But people will use these devices or use intimate devices or sex toys or whatever you want to call them. And they'll be like, I got a yeast infection from that device, or I got a bacterial infection from the device. Well, the one thing I have to clear up, and it's really hard for me to get people to understand this, especially when they connect, like I used the device and then I got the infection. So the devices don't harbor bacteria. A lot of them, it depends on the company where you get them from, but a lot of times the materials that are made out of can easily be cleaned. And also, when these devices are outside the body for a certain amount of time, those organisms are not going to survive for very long. But the idea is, anytime you use any kind of device, you want to make sure you're cleaning it with soap and water at least. Sometimes they do sell these nice little UV light boxes on Amazon that I tell people to pick up and just throw those things in there and clean them off. But
Yeah.
more often than not, why you're getting a yeast infection or a bacterial infection or a vaginal or a bladder infection after using a device is more so that bacteria was already there from the gut or from the vagina, and just the stimulation from, if it was a vibrator, it could be just the stimulation of the tissue that caused a little bit of irritation, and now that bacteria and yeast now could get in and cause an infection. But those
Right.
bacteria and yeast are already there, especially with urinary tract infections. It's just, this is why we tell people to pee after intercourse or any kind of sexual activity, is to flush out any bacteria that might, or yeast that might have gotten pushed up into the urethra and into the bladder during activity, because the urethra and the vagina are right next to each other. So yeah, the idea is that that bacteria was already there. It's just that any kind of stimulation in that area kind of just triggered it to like get a little irritated and then activated, let that yeast and bacteria kind of like take over. So that, but
Yeah.
the devices themselves don't harbor bacteria or cause any issues. So
When it comes to the UTIs, what about, like, I mean, I watched my mom go through this where it was just
yeah,
like over and over. The antibiotic use was insane, but she was in so much pain.
that's the vicious
And I've,
circle. That's a
it
vicious circle
is.
because it's coming from the gut and the vagina being off. And then we give people antibiotics, and one course of antibiotics for UTI can throw off the microbiome of the gut for a year, especially if
Oh
it's like
my
something like
gosh.
ciprofloxacin. So now you got to, but listen, when you have an infection, you got to clean the infection. We can always rebalance the gut later. But the
Yeah.
problem
Yeah.
is no one's realizing, because that's what we see, is that people get a UTI, they get on antibiotics, then they're good for a couple months, and then it comes back because that bacteria overgrowth is now still in the gut, and so it becomes this vicious cycle, and then they go on more antibiotics, and then, so it's really trying to get everything back in balance, and it can happen. It just takes a little like time and effort. um I do still like cranberry supplements,
Yeah.
amazing. D-mannose. So D-mannose is a type of
D-mannose is
sugar
great.
that basically,
Methylene blue.
methylene blue. Yeah.
Oh,
Yeah.
so good for UTI.
Yeah. So all those things are really, really good. Yeah.
And do you use boric acid for
Oh, I
anything?
love boric acid. Yes.
For
Absolutely
UTIs
love
or
both.
just yeast?
I like it for everything. So
Oh,
nice thing
okay.
about boric acid, so is it will balance the pH of the vagina. So whether it's
Mm.
bacterial or yeast, it kind of kills two birds with one stone. So, they did a study where they looked at, like, when someone gets itching and burning and discharge, most often women think it's yeast, but
Mhm.
80 something percent of the time it's actually bacterial. So, in fact, actually, there was a time period where the companies that were making over the counter yeast medicine were trying to get boric acid taken off the market because they realized it was going to actually
Those
affect
sons of
their
bitches.
it was going to affect their sales. Well, they lost that battle, thank God. So the nice thing
Thank
about
God.
boric acid is it'll take care of it whether it's yeast or bacteria. So,
Oh, that's so, and that's in
yeah.
suppository form,
Yeah, a
just
lot of
so
times it's
everybody knows.
yeah,
Vaginal suppository.
vaginal
Yeah.
suppository. And it depends
Yeah.
on the situation. Like I said, any of the things I'm mentioning about medical treatments, check with your doctor, your health
Of
practitioner, make
course.
sure it's good for you.
Yeah.
But, in general, it's kind of like when I want to set the reset button on a vagina, depending on the patient and the conditions and what I found, I will have them do boric acid anywhere from a week to 2 weeks just to kind of reset things. But then
Yeah.
once again, then we got to make sure that that vaginal tissue is set up to actually
Right.
then support the microbiome,
Yeah.
when we're ready to kind of reintroduce some healthy
Yeah.
bacteria. Yeah.
And I think I read a stat recently that it was over 50% of women will have urogenital symptoms of menopause.
Yeah.
So more than half of us
Yeah.
are going to run into something like this.
Yeah. And
It's
the other thing
so
is sometimes
great
even
to
if
hear all
even if
this
it's
information.
not a urinary tract infection, just from the thinning of the tissue that happens, and if we get those microbiome shifts, there can be this low level inflammation that can actually trigger urinary urgency and frequency or getting up a lot at night.
We need to know this information so that we can now pass it along to our daughters, our, granddaughters, our nieces, so that the women coming up behind us now they're going to know these things when they go into perimenopause and be super aware of, okay, this is what can happen. Let's start early. Let's get on top of things before it gets really bad, because more than half of us are going to experience these things. All right. Well, thank you so much for coming on the show. It was just, oh, I love all of this information. I've learned so much. I know, me too. Thanks, Betsy.